Hi, I'm Cameron Neal, and today I'm going to be teaching you about white blood cells. White blood cells are a major part of our immune system. They are rather large cells that circulate in our blood and in our lymph, which is fluid that is in our lymph nodes and in other parts of our bodies. And they are the living parts of our bodies that protect us against invaders, so bacteria, viruses, parasitic worms, and anything else that might get into our bodies that could cause us harm. Now, white blood cells come in 5 varieties: neutrophils, lymphocytes, eosinophils, basophils, and monophils. And an easy way to remember those complicated names is by remembering the phrase, "Never let monkeys eat bananas." And that tells you the order of the white blood cells from most common to least common as well. Now, each of the white blood cells has a different job. They all do something different, but they all work together to make us healthy, right? It's not just one acting on its own. And I'm going to take you through each one of them and tell you what they do and the relative concentration of them in our body relative to each other, the percentage, and I'm going to show you what they look like. I'm actually going to draw them out for you and show you what they might look like on a microscopic slide. So we're going to start with neutrophils. This is what a neutrophil looks like. So you see right here, this and this connected by this little line is the nucleus. These little dots are what we call granules. Granules are little collections of organic material inside of the cells that contain things like bleach or hydrogen peroxide or other things to that the cell uses to fight off invading material, right? So a neutrophil makes up about 50 to 70% of your white blood cells, and they are the bacteria slayers, as we call them. Okay, so what they do is whenever you have a bacterial infection, they go up to the bacteria and they kill them, right? They either drill holes in them and then water rushes in and the bacteria explode and then some other white blood cells clean up, or they can actually go and consume the bacterial cells and digest them with enzymes, right? So it's not a very fun death, right? So that is our neutrophils. Next, we have lymphocytes. This is what a lymphocyte looks like. Okay, and it's actually a pretty small cell. They're not large, and they come in 2 varieties: T cells and B cells. So if you've ever heard somebody talk about T cells or B cells, this is what they're talking about, a lymphocyte, right? They make up about 25 to 45% of our white blood cells, and they're very important. Our T cells actually prevent us, usually, whenever they're working properly, they prevent us from getting cancer, and they prevent us from viral infections actually spreading to other cells in our body. So the way it prevents cancer is it goes up to a cell that is mutated, whose DNA has been mutated, and it sort of almost sniffs it, if you will. It looks for an actual chemical on the surface of that cell, the T cell does, and if that's not there, the T cell, again, which is a kind of a lymphocyte, will actually destroy that cancerous cell. Okay? So lymphocytes, T cells and B cells actually kill our own cells when they're not doing what they're supposed to do. B cells additionally also produce what we call antibodies. I'm sure you've heard that phrase before, antibodies. Antibodies are proteins that go to, that actually attach to invading cells and prevent them from hurting our own body cells, right? So that is the lymphocyte. Now we have monocytes next. This is what a monocyte looks like. Basically, you have a large bilobed nucleus connected by a small piece of organic material, and then you have the cytoplasm around it, right? So a monocyte fights our chronic infections like tuberculosis. Whenever we get an infection like that, these turn into what we call macrophages. Macrophages go up to the invading cells and try to kill them. Now they're different from neutrophils because neutrophils are cells that kill short-lived infections. Monocytes are the cells that will go and participate in a longer disease process. Okay, and they're about 3 to 8% of our white blood cells. And next we have eosinophils, which are actually pretty interesting. This is what an eosinophil looks like. They make up about 2 to 4% of our blood, and I notice I forgot to write out the name actually all the way. So again, they make up about 2 to 4% of our blood. They look like this. Again, they have a large bilobed nucleus, as many of the white blood cells do, and they have little granules inside of them, 2 different colors. And they actually are what protect us against parasitic worms. So whenever a parasitic worm invades, like a tapeworm or a roundworm or any kind of a flatworm or whatever, a bunch of eosinophils will go up and congregate around it, and they will actually drill holes in the sides of these worms that kind of digests them away with enzymes, right? So we have our eosinophil, and a worm that's infected our muscle tissue, let's say, And these eosinophils will go up to the offending worms, and they'll congregate around there, and they'll release a bunch of enzymes, and those kind of digest the worm from the inside out. And then when it's dead, other cells will go and actually finish the job and remove the foreign material. So those are probably one of the most interesting white blood cells. If you ever get a tapeworm or anything like that, your eosinophils are going to be working quite fervently. And then our last blood cell, our last white blood cell, is what we call our basophils. They're called basophils because whenever we stain the cells, they turn sort of a violetish or bluish color, right? Because whenever we actually look at tissue, most of the time we can't really see it too clearly, so what we do is we treat the cells with acidic and basic and other dyes that will make them turn a certain color so that we can see them more clearly. So basophils are sort of a bluish color oftentimes. So this is what a basophil looks like. It's kind of a large cell, and they are the least common of our white blood cells. They only make about 0.5 to 1% of our white blood cells. Now, our basophils are involved in our allergic reactions, as are a few other cells. So basophils have these little granules inside of them that contain a substance called histamine. And so whenever an allergic whenever something invades our body, whenever we smell something or whatever that we're allergic to, the basophils will release this histamine, and the histamine will actually make us have inflammation, watery eyes. Sometimes we can even have a really bad infection or allergic reaction, excuse me, and we can have what we call anaphylactic shock, which is where our blood pressure drops really, really low, and we could die from that. And so people who have maybe are allergic to bee stings or something like that carry around an EpiPen, and that stops the histamine. It's also what antihistamine drugs like Benadryl do. So if you ever take an antihistamine, that is stopping actually the reaction, our body's reaction to the histamine that basophils and other cells produce. And that is the last of the white blood cells. And I hope you found this interesting, because maybe if you're going to the doctor one day or whatever and you hear one of these words, or if you're at the hospital and you're battling an infection, it might be really, really useful to you to know what these white blood cells are, what they do, how many of them relatively there are in your body, just to know what your body is going through, what your body is trying to fight off whenever you have an infection or something like that. So I hope you found this interesting, and I hope you liked the video. So thanks for watching.